Hi, my name is Chandan Modem, and this is my presentation for the next pandemic. My new disease is called AHC24, and AHC24 is a novel disease that leads to acute heart congestion due to the bacterial pathogen Neuroxia hepticide that enters the body through either oral or blood-based means and causes short-term heart congestion due to the blockage of the aorta it induces. The 24 stems from the fact that this disease was discovered in the year 2024. Now, the bacterial pathogen Neuroxia hepticide is what leads to AHC24, and there are many factors that lead to a high risk of this pandemic developing. Firstly, AHC24 is transmitted through blood. Blood testing during blood drives does not account for the presence of Neuroxia hepticide due to the novelty of this as a pathogen type, so it often can pass through undetected. Also, AHC24 has a high RO value at 6.2, which is well above the range for quick disease spread, meaning it can easily pass through a population and quickly decimate it. For context, cholera had a RO value of only around 3, and yet it still spread so quickly. Lastly, AHC24 only has a 16-hour incubation period, meaning individuals can quickly develop symptoms and be placed out of commission very quickly. This can happen on a global level quite quickly as well. And now, in terms of risk assessment, some specific risks of AHC24 to specific demographics is that AHC24 spreads orally. So the cultural practice of either kissing by lips or cheek as a form of greeting in many countries could result in high rates of oral transmission of AHC24. Additionally, as a contact-based disease, AHC24 also spreads far quicker in situations where living conditions are cramped, water sources are left untreated, and these conditions are more prevalent in low-income areas. Lastly, given that this disease is spread in many ways similarly to sexually transmitted diseases, and given the taboo nature many cultures approach these types of diseases with, this could lead to further stigma and lack of treatment options in certain cultures, similarly to what we saw during the HIV pandemic. Now, in terms of disease surveillance, two major strategies would be mandatory reporting. This would be one example of a surveillance strategy, which would significantly reduce the impact of, as we have seen in other historic pandemics such as HIV and AIDS, and this is because of the early detection and response that it induces. And additionally, contact tracing would also be another useful strategy, as this disease spreads primarily via human contact. So establishing who has been in contact with other people infected by AHC24 would significantly lower the chances of further contact being established and would thus significantly reduce disease proliferation. And now going into disease management, one strategy that could be implemented is the use of vaccinations coupled with booster shots if necessary. This could have a major impact, as this would create herd immunity and lower disease incidence rate. Mandatory blood testing, additionally during doctor's visits, would also significantly reduce the risk of this disease, as it's primarily transmitted via blood. And another impact it could have would be providing information about other blood-transmitted diseases as well, due to the full comprehensive testing done through mandatory blood screening. And lastly, antibiotics. Given this is a bacterial disease, early delivery of antibiotics can significantly prevent transmission and contamination as well. And now continuing with the last method that I mentioned of disease management, the use of antibiotics, here is an example of that plan being incorporated into the Central African Republic. And now, starting with the plan, the first phase of antibiotic management would be the planning stage. The central government of the Central African Republic could collaborate with both the Central African Red Cross Society as well as the Bangui University Hospital to serve as both distribution hubs and as testing sites for the use of antibiotics, and this will be spread to counter Neuroxia hepticide. The next phase would be the distribution step. This would involve a combination of corporations between the government, major international health organizations such as WHO, as well as local distribution sites such as local hospitals and clinics. Access should be immediate across all parts of the country, including rural areas, so investments would need to be made into truck transport as well as shipping. Lastly, the final phase would be the monitoring step. tracking the use of antibiotics in this country and seeing the impacts it is having on the local communities. This could involve a mix of evaluations and reporting at clinics, general community feedback, as well as a statistics-based approach, ensuring the number of transmission rates is going down, as this is the primary purpose of disease monitoring through antibiotics. Now, I'm going to respond to prompt A, which addressed communication, and communication would have to be quite different in city versus rural areas in this country, for instance, if I compare two geographic locations. The Central African Republic is a land of contrast, even language-wise. The urban areas often have high levels of French proficiency, but the same cannot be said for rural areas that primarily use local languages. And Bangui, a large city, the community can be mostly electronic and digitally introduced to the spread of antibiotics because there's a lot of technology access here. So this would be a way to effectively spread the message to many people quickly. However, in smaller cities such as Bambari, there's not as much technology access and digital methods. So local outreach programs would actually have to do the heavy hitting, and they would have to come to these rural communities and proliferate and spread the message of these antibiotics and give access to them in these small condensed areas where there is not technology access. Healthcare providers would receive this information in terms of transmission rates, for instance, reduction in infected individuals, etc., more so direct statistics. But if we looked at another population such as the general public, they would receive more personalized information, so highlighting their decreased risk of getting the disease by receiving antibiotics compared to not receiving them, and also the impact antibiotics would have on their local community as well, such as direct statistics in their community over the number of people introduced to the antibiotic who got cured of AHC24 compared to those who didn't take the antibiotic. All these are different methods that could be used to incorporate the spreading of how antibiotics can be spread in Central African Republic to widely different population types. So lastly, in conclusion, AHC24 has a high propensity to be the next major pandemic for a variety of reasons. From the high transmission rate and low incubation period to the high incidences of contact-based transmission, this is a very novel and unique pathogen in the way that it is bacterial, but causing heart-related issues, so the suddenness of this could proliferate the disease rather quickly. Finally, many cultures have traditional practices such as kissing as a method of greeting that will further proliferate this disease. And now lastly, here are my references: a basic Central African Republic demographics profile, and as well as a general listing of antibiotic prescription and usage from the Centers for Disease Control and Prevention was used in this presentation as references. Thank you very much.